Yes. The problem with COVID-19 lung infections is that frequently there is your own immune system overreacts to the situation with inflammatory byproducts. And they can actually fill the lung with those inflammatory cytokines, which are proteins and carbohydrates that can create an inflammatory response. And that process can damage the lung, and scarring of the lung is a byproduct of that situation. And what we have, we didn't develop this for COVID-19, but we were using the same approach for treatment of chronic obstructive pulmonary disease, COPD, is that if you use a combination approach of intravenous stem cells combined or the milieu of cytokines, growth factors, exosomes, and stem cells, as well as nebulized milieu like that, then basically you're treating the inner part of the lung alveoli, which is the air sac. You're also treating the interstitial part, which is the connection between the air sac and the artery. So the defect that's caused by the scarring is a decrease in both oxygenation and ventilation. Obviously, oxygenation is getting the oxygen into the blood to go to the cells. Ventilation is getting rid of the carbon dioxide. So if the scar tissue blocks both of those, then the net result is that the efficiency of the lung deteriorates. And we feel like that the combination treatment can help both the interstitial side and the alveolar side and help restore better function to the lung. Yes, as I mentioned earlier, the patients that we have treated in our treatment protocols involving stem cells and the stromal cells, actually, they're not just stem cells, but stromal cells, as well as concentrated platelets. You're also giving growth factors and cytokines, which are beneficial to signaling, and you're giving exosomes, which are beneficial to signaling. And we think that that's a very safe method, and we have not had problems with adverse events from the injection of this milieu. Yes, actually I have. I had COVID. I had x-rays taken after I had recovered from COVID, prior to having a hip procedure, and they identified scarring in the left lower lobe of my lung. And sometime later, I needed to have another procedure that was independent of lung issues, and they took another x-ray and showed clearing of the scar. And between the two, I had the treatment that I just described for the COVID scarring in the lung. And the only explanation for why the scarring had resolved was because of the treatment.